My name is Joe Cass. I'm one of the orthopedic trauma surgeons here at Mayo. I've been here for 6 or 7 years, but I've been in practice for nearly 30 years. And I've been asked to talk about farm injuries and the timeliness of referrals and appropriateness of referrals, so that's what my topic's going to be today. I think I've taken care of farm injuries and general trauma both in a university setting or a level 1 center like this, but I've also taken care of them in a private practice setting where I'm the orthopedic surgeon and we may or may not have a team approach. And these injuries can be very disruptive to the hospital, certainly to the patient, extremely disruptive, life-threatening to the patient, but in terms of the flow of the patient care, they can be very disruptive to the healthcare system as well, and they very much require a team approach. So when you're in a setting that's not a university setting, you don't usually have residents, you may feel comfortable as an orthopedic surgeon taking care of the bony injury, but you don't have a plastic surgeon, or the plastic surgeon may be comfortable, but you don't have a vascular surgeon, so it's very difficult to organize this in the upheaval of a patient coming in with a devastating injury. And so it's often very appropriate to refer them to a level 1 trauma center and to do it in a timely fashion, because often time is of the essence. We had a patient just within the past several months that came to a healthcare center, and they recognized appropriately that the patient had a vascular injury. They did an angiogram at that institution and then realized that their vascular surgeon wasn't available. So they took the time to do that. They delayed his transfer to our center, which I think compromised the patient's outcome to a degree. So it's not that they weren't well-intentioned, they tried to do everything right, but there was just enough of a fly in the ointment that it really fouled things up. And so the advantage, I think, of a level 1 trauma center is not necessarily in the skill of any one doctor, but in the available skills of multiple doctors. So I think there's no question that these injuries can be better cared for often at a level 1 trauma center. Now, when they come in, it's a shock to the system as well as the patient, of course. And these can be life-threatening injuries, so you have to follow the advanced trauma life support guidelines of airway, breathing, circulation. You have to resuscitate them. You have to save their life. And then you have to figure out if you can save their limb, if it's a limb-related injury. Now, sometimes it's a chest-related injury or chest and extremity because they've been run over by the tractor, or they've got their foot caught in a corn auger, or they were working in some piece of machinery and it collapsed on them or caught their extremity in it. So it can be anything from a fingertip injury to a flailed chest with a ruptured spleen and liver and an open pelvis fracture. And so you have to sort that out almost on the fly. But you have to do the airway, the breathing, the circulation at the same time you're assessing them. Then, if there's any component of open fracture, almost as part of a reflex reaction, they have to get antibiotics as soon as you can feasibly get them to them, and to make sure their tetanus status is updated. Those are two things that are, from our standpoint as orthopedic surgeons with open fractures, it's more important to get those in as soon as possible than it is to do a debridement, for example. So I think that part is critical in terms of the timeliness. But again, life-saving and then limb-saving. And from a limb-saving standpoint, you have to know what their vascular supply is very carefully. You have to know what their neurologic supply is to their extremity. And then you have to be able to assess whether the limb is salvageable or not. And I think that's another advantage of a level 1 institution, again, where there are multiple specialists. So we might have a vascular surgeon, a plastic surgeon, the trauma surgeon, the orthopedic surgeon that's done several amputations, the foot and ankle surgeon who might be able to reconstruct this lower extremity injury, the hand surgeon who might or might not be able to reconstruct the injury.